to test for prostate cancer, right? And so that, so you can catch it early. It is a slow-growing cancer, but you want to catch it as early as possible because the treatments can be very aggressive depending on how late you catch it. And so I would say symptoms, yes. Some of the symptoms are okay. Pain with urination, decreased flow, but there are other complications with the prostate or other diseases in the prostate that can give you that. So you don't know which one it might be, but that's why you need to, from 45, you want to make sure you get that PSA.
Okay, so Dr. Swaby said a PSA. He's making a public service announcement, okay? It's for a prostate-specific antigen blood test. That's what you want to do. And he just mentioned that not every decreased flow or means that you have prostate cancer, okay? Because there's another condition that he alluded to, which is, we call it BPH, benign, means not cancerous, benign prostatic hypertrophy or hyperplasia, okay? So that is something that's treatable. You are not able to make that distinction on your own.
Right. That's why you want to go to your doctor at least once a year from the age of 45. Or if you have symptoms, right? If men, especially in Jamaica, because, if you have a family history, you might be a little bit more prone, and if you're not 45, you want to go get checked, right? So the best way is to, it doesn't go away by going to sleep on it. It doesn't go away by ignoring it, right? It only can get worse.
Okay. Dr. Cooper, do you have anything to add as a practitioner here for many years?
So the PSA blood test has been added to the National Health Fund services. So if you have an NHF card, you can get the PSA at a reduced price. So you need to just check your health center or your doctor, and they'll arrange for you to get the PSA test done.
Thank you so very much. All right, is there anything else? Okay, right here.
There's also the rectal exam, which many Jamaican men will shy away from. Sometimes, as Dr. Swaby would have said, is the blood test could be negative. However, when they do the digital exam, there is growth, an abnormality felt when it's done. So I would encourage, along with him, to not just settle on the blood test alone, man up and get an exam, a rectal exam, because that can actually save your life.
Yes. I was talking with Dr. Cooper earlier, and we're talking about that big distinction. What do you need for prostate cancer? The blood test. What do you need to distinguish the prostate cancer from the benign hyperplasia or growth of the prostate tissue? You want to leave that in the hands of the expert who's going to do a digital rectal exam. I think, Dr. Cooper, I was listening to you and you said something. It's not always just the absolute number that you're looking for, but the rate of change and the extent of change of that number. So this is not, they would say, don't try this at home, okay? Don't try this at home and think, don't fool yourself into saying it's one or the other. Don't stress yourself into thinking the worst, okay? But make sure that you put your care in the hands of a trusted practitioner, okay? Is that fair and
yes.
fair to say? Okay.
For prostate cancer and benign prostatic enlargement for men, Dr. Sorby has actually enumerated the symptoms, but I want to add to that. If you're a black man, 45 years old and above, you get into the bus and you can't wait to get to the next toilet or the next bathroom, you need to see your doctor. If you're 45 and above, you wake up 4 or 5 times in the night and you wee little at a time, get to see your doctor. The reason why urine is the symptoms that both present with is because the prostate is a gland that squeezes the neck of the bladder. The bigger it gets, the more symptoms you get with the bladder. So bladder symptoms are very, very important.
Thank you so very much. All right. Dr. Cooper, thank you so very much. I appreciate all of that. Again, remember, if you have a question, I'll be taking those momentarily, so please write that down, or right here. Someone has their hand up, just let them know.
Sylvia.
We need additional paper? Oh, you're letting them know that they should just request a sheet of paper from you. Very well. Okay. We've given the men a little bit of time here, and I'm going to go back because this is probably closer to my area of personal interest. Dr. Cooper, tell us a little bit about what is menopause, why are we so, I'm not going to say we're miserable. What's really going on the inside, why we feel so hot on the outside, and what else is going on when we talk about menopause?
Okay, so menopause is the time in a woman's life when her periods stop permanently. So it tends to happen in the age range 45 to 55. And we decide that it's permanent if you have not had a period for 1 year. So if you've had no periods for 1 year and you're between 45 and 55, you have gone through menopause. Menopause is due to a change in the hormones in your body. The hormones that are involved are made in the ovaries and in your brain. And as you get older, the level of hormones, especially the estrogen from your ovaries, starts to fall. So for years before menopause happens, you can start to experience changes related to the hormone level falling. So your periods can start to become irregular, or the cycles might get shorter. You might have bleeding for more days. You might start to feel hot flashes up to 7 years before your periods stop. You may have mood changes.
I heard that, oh
and
Lord.
This is called perimenopause, the changes that happen before the periods stop permanently. Once the periods have stopped, you've gone your 1 year, no periods, we say you are in post-menopause. But the same symptoms you were having in perimenopause can continue in post-menopause again for up to 7 years. And there are other things. Estrogen, apart from giving you the low levels giving hot flashes and mood changes, it affects more important things like your bones. Your bones tend to get weaker because there's less estrogen around. Your hair, your skin tends to change. You get dryness of the skin. The hair may be thinner on your head, but you might be getting hair on your face. So there are a number of other changes that the estrogen, falling estrogen level does.
Wow. Chantel, what have you been experiencing, hearing on the ground with women who have stopped seeing their period and the concerns they might have?
So for the ladies between the age of 45 to 55, you will notice symptoms of decreased libido. You don't have that sex drive that you normally have. You have, you're not, sex isn't pleasurable anymore, for the married folks, by the way. And you'll complain of this excessive heat that you have, and you have these mood swings, or the kids are like, what's wrong with mommy, you're not right, and stuff of that nature going on. And when you get to this point is when you need to, before you get there preferably, but there's nothing wrong with you mentally. It's a change your body is getting adjusted to. This is something that you have to learn to hone and adjust life to your partner, your children. It's a whole change within dynamic with the family where you get these symptoms. You don't shush them and push them away and deny it. You face it. Speak to your GP, speak to your GYN and say, listen, I don't know if this is normal or if this is just in my head, but here are the things that are happening to me over the last 6 months. And at that point, there are so many things that they can do to help you to get back to a normal state. And sometimes I must let you know that some ladies actually have, if the estrogen go too low, they have some mental breakdown, some mental health disorders that goes along with this as well. So don't think it is a joke. Don't hide it. I mean, if you have a cohort of ladies, speak it amongst each other, because we learn from each other.
Yeah.
So you'll say, hey, I'm experiencing this.
Chantel.
I'm experiencing this, and any one of you have seen this or felt this, and when you get that information, then you can you'll realize that actually I'm not crazy a little bit. But I can go to the GP or your GYN and discuss it further for treatments, because there are treatment options out there that can help you feel better and restore your bedroom your bedroom stuff going on with you and your spouse.
Dr. Cooper, so this is a change that's normal, predictable as women age. Is there hope for that individual in terms of alleviating or making those symptoms better? What could we do?
Yes. So, as Chantel said, there are treatments available. There are medications available for people who have severe symptoms. And this is not necessarily that you're going to get estrogen as a hormone, but there are non-hormonal treatments that can help. But most women don't need medication. For a lot of women, there are lifestyle changes that make a vast difference. So like with the hot flashes, do things to keep cool, wear cool clothing, sleeveless, short sleeve, breathable fabrics like cotton. Try to avoid things that make you more hot, like very spicy food, hot drinks, caffeine. So if you have a choice, drink something cooler, not ice cold necessarily, but something that will help to cool you down. If you can put something cool on your wrists or on your head, that helps you to cool down quickly. In terms of the other lifestyle things, make sure you're drinking enough water, and there are herbal treatments that work well for some women. Things like black cohosh and red clover and evening primrose oil. I'm sure you've heard about, many of you will have heard about these, and they're easily available at health food stores and pharmacies. So these are things you can try. They work for some women they don't, but it's worth a try. And if all else fails, go see your doctor, and they can prescribe something appropriate for you.
Okay. Miss Allison.
Yeah. Something also to add, what I've noticed with women when they're going through the stages in their life, they tend to start gaining a lot of weight, and they start blaming it on the fact that I'm going through a change of life. And a lot of time it has to do with whenever they start feeling hot or they start feeling some of the symptoms, it gives them that desire to eat. Or drink something, or they want to drink something and they tend to find soda or they drink sugary beverage. And if you have to understand that sugar beverage is very high in calories. So then you don't want to be as active because you don't feel your best. So now you're increasing your calories in sugar beverage and you are not being as active. And that's what we do notice. And something actually that I notice even in my practice is a lot of times I find some of these symptoms will decrease once they start decreasing on dairy products and also some of the animal products. And a lot of it has to do with the dairy products. If you get in I'm not sure about Jamaica and how they milk their animals. You know, I'm not 100% sure with the agriculture there, but I know a lot in the US, they milk their animals when the animal is pregnant. So if you're getting a lot of dairy products from the United States, and which is it is in some of the foods that are here, a lot of those things are, you have a lot of estrogen and a lot of different hormones that are in the milk product or the dairy product. And sometimes I do notice that when they do decrease on the dairy product, some of the symptoms go away. So that's what I have found out.
It's always a good thing, whether or not, gentlemen, even if you are not menopausal, to cut back on meat, to watch your dairy product is always a general good advice. All right. I think we've covered everything, and I see Dr. Campbell over on the side there. Being a pulmonologist, I've heard him say, if you fail to inspire, you will expire. You know, he thinks the lung is where it's at and not over in the heart, Dr. Dunn. So it's up for debate right there. But tell me something, Dr. Campbell, about, I've heard this term, OSA or obstructive sleep apnea. What is that? How would I suspect maybe I have it? Is it just snoring or is it something else?
Thank you for getting me involved here. I've heard about being a stepchild. I was sitting here saying I'm probably a step doctor. And yes, the heart is a very valuable organ in assisting with the blood to get to the lung to become oxygenated. So the heart does provide a valuable service. So that's good, Dr. Blanchard, Dr. Dunn, we appreciate that. To answer your question, let me tell you about Derek. Derek, he's not in this church, he's not from Port Antonio. He's a 32-year-old young man who presented to his doctor because of a complaint of loud snoring, observed breathing pauses, fatigue, low energy state. In fact, Derek informed his doctor that at times he would feel more sleepy in the morning and waking than when he went to bed the night before. He even went on to share with his doctor that as a child, he hated going to school because he would fall asleep in class. As a matter of fact, on one or two occasions, he even fell asleep during an exam. He was bullied, called dumb, dunce. He wasn't able to concentrate very well. His memory wasn't the greatest. And so he hated to go to school. In fact, later on, he even hated to visit his friends or family members. He just didn't want to spend the night because of being criticized about his loud snoring. His doctor examined him, noticed that he was a little on the heavier side. His blood pressure was 144 over 84. That was high. His heart rate was irregular. The doctor examined his heart. Heart rate was noted to be irregular there. And because of a likelihood that he could have sleep apnea, he was sent to a sleep doctor who then diagnosed a condition called obstructive sleep apnea. Apnea is pauses in the breathing. Person actually stops breathing, and is usually caused by an obstruction to the airway. So the ability of the upper airway to stay open is dependent on the tone of the muscles that line the airways. When the muscle tone is lost during sleep, you can imagine what would happen. The airway closes off, there is absence of airflow, decreased airflow, there is low oxygen. Low oxygen level may lead to abnormal heart rates, abnormal heart rhythm. It may cause a strain on the right side of the heart. So obstructive sleep apnea is a serious condition that has cardiovascular risks such as high blood pressure. So obstructive sleep apnea is a cause of high blood pressure. So I know this is a long answer to your short question, but obstructive sleep apnea is obstruction to the airway during sleep that leads to many complications, including cardiovascular complication, and it's more than simple snoring. And if there's this likelihood that someone falls into the picture that I just discussed, that person should see his doctor.
Thank you so very much. Is there anything that Derek could have been done for Derek when Derek was a child? Is the treatment different for the child than for the adult with sleep apnea?
Yes, so that points to a level of awareness.
Got
If
you.
Derek's patient had come to AY at Port Antonio High School, they would have learned about obstructive sleep apnea. So this is what we're trying to do, just share matters, issues that can make a difference in our lives. Because if we don't know, there's not a lot we can do. Sure, they could have taken him to his physician and try to determine what those problems were, if indeed they were identified as problems to begin with. There are challenges, barriers to seeing a physician, financial barriers, and so forth, but a level of awareness is very important in all that we do, and so issues, programs like this, events like this, can spread the news regarding obstructive sleep apnea and other disorders.
Thank you so very much. All right. I'm about to open the floor. Thank you, providers. I'm looking at Chantel, and while you're getting your questions organized, is there a roving mic? Is there someone who'll have a roving mic that could help me with the audience? We'll take one of yours, but I'm going to actually be using yours. You're asking your question, Chantel. I too am from Jamaica. What's the latest version? What's the latest news on douching for women?
Stop. Don't do it.
Put that mic up a little bit closer. Say it again.
Douching. Stop. Don't do it.
What's wrong with it? It's supposed to make you feel fresh.
No, ma'am. No, ma'am. Douching is an old myth that many years ago was encouraged because they said it cleanses the vagina. It's an old myth, and it's not true. When you douche, you change the natural flora of the vagina, setting yourself up for more issues than you need. You have bacterial vaginosis, you have vaginitis, you have so many other things that you get when you practice this. some of our young ladies, you'll notice they'll come in and, you're doing an exam and you'll ask, hey, have you noticed that fishy odor? And they're like, no, I've had that. No, that's not normal. That's usually a bacterial vaginosis. Therefore, the flora in the vaginal vault has changed from a bacteria, and therefore we need to get it treated, usually with some form of antibiotic to get that. We need to maintain homeostasis. Do not try to wash out inside the vagina. Nope, please don't. Do not put any douching vinegar-based anything inside the vagina. No. Unless it is prescribed for a specific infection, in fact, besides a tampon. Nothing else should be inserted in there, please, because you're setting yourself up for more than you really want, bargain for.
Thank you so much. You're telling me if I leave the vagina alone, it stays in good balance and doesn't need my help to freshen it. Okay, it's not like a room to go spraying things in. Very well, I appreciate that. I go to my experts. All right, do we have a question from gentleman here, a lady over there, and then the sister on this side? We'll take them in that order.
My question is to the doctor who speak about high blood pressure and high cholesterol. Before I ask the question, I want to say something. Last year, I suffered from high blood pressure and high cholesterol. And I even had, I was overweight also. I fainted and I was taken to the doctor. And the doctor encouraged me to change my diet, to lose some weight, and to begin exercise. I do a lot of tests also, and I was on some medication. That was last year. I changed my diet. I took off at least 65 pounds, and at this moment, I'm not taking any medication. But my question is this. I'm exercising now still. Why exercise, continual exercise, and a change of diet continually have to do with high blood pressure and high cholesterol? What have to do with them? Because I'm feeling good now because I'm exercising and I'm still on my change diet. I'm not overeating. Once I use so sleepy, I'm start sleeping. I'm lower on my, I don't eat much starch, and lower on my, I'm drinking water instead of drinking sweet drinks. So what exercise and diet and a diet have to do with high blood pressure, high cholesterol?
Thank you so much for that question, and I'm going to direct it to Dr. Dunn here. Go ahead, Dr. Dunn.
First of all, let me commend you on your weight loss because let me commend you on your weight loss because that's a huge feat. It's not easy to lose as much as you lost. Even, 5 pounds is good, 65 is amazing. So that's really good. It's great that the lifestyle modification allowing you to get to where you are right now, where you're off. I'm hoping your doctor stopped the medication and not you by yourself. But to where you're feeling better and you've even noticed a change in no longer sleeping throughout the day as you were before. It's possible you had sleep apnea. But you're a testament to why that actually works. When you're overweight, first and foremost, when it comes to diet, how we eat, like someone will say, and I'm sure everyone has heard that you are what you eat. How you eat, overeating, weight gain, and obesity, being overweight is not good for anyone. All our organs are able to function at a certain capacity. Whenever you're whenever you carry more weight on you, they're doing way more than they need to do. And so the heart and the full vascular system is literally forcing itself to work harder when you're eating these fried fatty foods. All the excess fat, the excess sugar gets deposited in your arteries, and it narrows those arteries. The arteries will be like this. When you have excess sugar, your diet consists of excess sugar. When it has excess fat, it literally deposits in the blood vessels, and they become smaller to like this. So imagine like a pipe, if you can think about it. You know, water is flowing easily when it's going through the vessel how it's supposed to go through. And then when you constrict it, think about the pressure and the force that it has to overcome in order to allow the blood vessel to, or the organ to work how it should. So that's the exact same mechanism that the heart and all the organs function under. And that's why the weight loss for you, especially such a significant weight, made the difference for you.
So thank you so much for that question.
I would like to.
Okay,
Yeah, I would
we'll
like
give
to
you
say
a moment
something.
so that we can make sure we get to everyone.
Great job. Continue to do what you're doing. And what the doctor said, and I'll add something to what the doctor says. You are what you eat, but you are what you digest. Because a lot of times we, you know, how our body is digesting and breaking down the food. Something that I did not hear from you is, are you testing your blood pressure on a regular basis now? Okay, so what I would recommend to you, because as a dietitian, I do see a lot of clients like you, and I would recommend to you, even though you made those changes and you lost the weight, and I commend you, but you want to know that you need to, it's your responsibility as you work, you know, knowing your body and work with your healthcare provider in order to continue to achieve those results. So you would need to test your blood pressure, you know, on a regular basis, write those numbers down and bring it to you when you're going to your healthcare provider. Because sometimes our numbers change and they go a little bit higher because we're stressed, we're rushing to go to the doctor, and the number goes up. But when you're testing it at home, you can get those true numbers. And what you might want to do is to bring your monitor with you when you go to the doctor and compare the numbers, because sometimes your machine might be off. You might be off. And you ask the question, why did what I do make those changes? And as the cardiologist mentioned earlier, is that in your body, and she talked about your blood vessels getting narrowing, inside your blood vessels, when that pressure of the blood goes through that blood vessels, inside of that is called endothelium cells, and those cells are being damaged by salt, sugar, and saturated fat. And when those damage the inside of it, it causes inflammation. And then when the blood pumps through that artery, it stiffens up. And when it stiffens up, just like the doctor says, it starts putting that pressure, and then your number goes up. But sometimes we start getting comfortable with our results, and we start saying, I'm good, I'm exercising, and I'm eating right, but we don't know where our numbers are. And just like, and I don't want to burst your bubble, but if you don't continue what you're doing, it will come back with a vengeance. So I really want to just tell you that from what I've seen over the many years. So again, thank you so much for taking care of yourself.
Thank you so much. Okay, everybody wants to add something to this one.
Over the last couple of days, I have noticed that lots of the patients that I've spoken to, they'll tell me, I stopped the blood pressure medicine after 2 weeks because I didn't like how it made me feel. You have to understand, when you have high blood pressure, you're functioning here, which is not normal. So once you start taking that blood pressure medicine and it starts bringing you down to the real normal, you are going to feel off. It's going to make you feel a little bit different because the normal for you is here. So when I'm changing that, you are going to feel, but you have to push through. Continue taking the medication until your body balance, homeostasis is achieved, and you get to where the real normal is and not this high normal. So I just want to say, don't stop your medication because you don't like how you feel. Push through, and then you'll get to the other side.
Thank you for doing that promo from pharmacy right there. All right, Dr. Cooper?
Just a quick comment. Many people may not have a blood pressure monitor. So if you don't have a blood pressure monitor at home, most pharmacies will do your blood pressure for you, or you can get it done at your health center. So even if you don't have a monitor at home, you can get it checked. And you have to know your numbers, as everybody else has said. Just because you feel good doesn't mean your blood pressure is normal. And your cholesterol, you cannot know what's happening with it unless you do a blood test. So even though you have lost the weight, you still need to go back to your doctor, get the cholesterol blood test done, and follow up with your blood pressure.
Awesome. I'm going to now give an opportunity for this young lady into the back here.
Okay, good afternoon.
Good afternoon.
Alright, so my question is related to the medication. So, yes, many Jamaicans don't like to take their medication. Reason being, side effects. What does it do to my liver, my kidneys, especially the high blood pressure and the cholesterol medication? So can you relate to that, please? Yes. So
Did you want me to start with that answer for you?
Yes, and then I have another.
Okay, go ahead, and so I'll take both.
The other one is relating to the menopause and the symptoms. How somebody said they're going for 7 years into post-menopause, but suppose you have persons in their 80s, 90s still having. So what is happening to that person?
Okay, I'm going to let Dr. Cooper answer that. Do you want to answer that one first?
Yes.
Okay, I'll take your second question first, if that's okay.
So somebody in their 80s or 90s having symptoms that seem to be related to menopause, those symptoms are not due to menopause. There's something else going on. That person needs to see the doctor to get properly examined and tested. That is not menopausal symptoms. 80s, 90s, it is not menopause, okay?
Okay, I think she said it. It's not menopause. Dr. Campbell, do you want to take the first question that was there? My medicines give me side effects, things like liver disease and maybe kidney, especially with my blood pressure medicines and so on. What do I do?
Every medication on the face of the earth has potential side effects. It doesn't necessarily mean because those side effects are listed and are discussed, it doesn't mean that you will get those side effects. That is why it is very important that you follow up with your doctor so you can be properly educated, you can have a good discussion as to what to look out for. Sure, there are certain medications that may cause kidney or liver problems, but those side effects have to be discussed in the proper context. Bear also in mind that you mentioned high blood pressure and diabetes. Bear in mind that those are major risk factors for cardiovascular disease. Bear in mind that high blood pressure and diabetes can cause kidney problems. So it calls for a balancing. But you need to be informed about the side effects, yes, but make sure your care is being carried out as a partnership between you and your doctor, and those issues are discussed.
Yes. Thank you so very much, Dr. Campbell. As a pharmacist, I have to say, medications may have the side effect, we balance. Do I get more good than bad out of the medicine? Remember, the hypertension can cause the kidney disease. So the disease itself basically has side effects, right? So we have to, as Dr. Campbell said, strike a happy balance between the long-term benefits versus a theoretical or lower chance within reason for the meds to give a problem. Give it a try. All right, there was one.
Can I ask her a question?
Oh.
The young lady that asked the question about the side effect of the medication and all that, usually when you get diagnosed with these, high blood pressure, diabetes, high cholesterol, did you sit with your healthcare provider and try to figure out, because sometimes the healthcare provider will say, okay, your numbers start going up now, maybe we can start doing some lifestyle change. Let's give you 3 months, and then we'll watch these numbers. But as I'm sitting here, you're wearing glasses. You need glasses, right, to see? There's sometimes in some incident you need medication in order to achieve what the healthcare provider is trying to do. So sometimes we see medication, we have to put it into perspective.
Absolutely.
We have to look at it. You need your glasses in order to see. So sometimes you're going to need medication until you can maybe do lifestyle change or you work with your doctors and they can decide that, well, let's try 3 months of lifestyle change.
Thank you so very much. All right, just to make sure I honor your time this evening, I'm going to ask that we keep our questions short, direct, and our panelists be short and direct. I hope it still sounds with the love that we want to share, but that we're respectful of your time. Very well. This lady right here had a question and was waiting.
I just want to get clarity. Are you in support of naturopathic medicine, or do you just prescribe just for, medication? I know some of it is coming out, and I heard the members' responses to different side effects. But do you, if someone said they had a condition and they came to see you, and then you started to write out their medication, what they needed, but they had done some research and were around a body of people who are medical missionaries, I'm not sure if you're familiar with that term, and they prescribe to natural remedies. I'm not saying doctors are not good, they are excellent, but at the same time as well, there's a role for the naturopathic medicine. Just want to have your comment on that, please.
Okay, I'm going to give it to one person.
I could speak a little bit to that.
You want to take it, Dr. Swiby? Is that right?
So, there's a lot I do. So, but just think about it though. Now, just like Dr. Campbell said, every medicine has side effects. So even naturopathic medicines have side effects. So just because something says it's natural doesn't mean that it can't have a bad effect, right? Because a lot of the medicines that we prescribe come from plants, come from natural, but they've been synthesized. So just because it's natural, so it's better that if you are taking naturopathic medicine, and I believe that there are more than one way to skin the cat, but the way to do it is with your doctor, and not and sometimes it's hard to find a doctor that is willing to go both ways, and I understand that. But there are doctors, but if you're going to go natural as well, you also have to make sure that you're doing the workup, the follow-up, the labs, like all the things that you're doing, not just believe, well, it's natural, so it's better and there's no side effects. So you have to take it as seriously as if you were taking the medicines, especially if you're thinking about naturopathic, right?
Okay, there was a question that came by paper, so I'm going to allow Dr. Alidepo to read for us the question that he had. Ooh, I got some more. Thank you.
The question I have here says, why does my period come 2 times for the month? Very good question. I'm going to give you 2 illustrations just to explain why this is. So bear with me. Now, in medicine, when we see you, we sit down with you, ask for your age, your name, and ask other questions. The reason we do this is for something like this. If you consider an 8-year-old girl and a 60-year-old woman who goes to see a doctor, the 8-year-old girl says, they talk about period, I haven't had a period. The 80-year-old lady says, I'm getting periods. For the 80-year-old, she's not supposed to have periods. So you reassure her and send her home. For the 80-year-old, like one of my colleagues said, menopause is when period stops. And when it stops, if you have any period, you need to see your doctor. These are signs of endometrial or womb cancer. Okay? So to be able to answer this, I'm going to give you another illustration and then sort of group that into age groups and what we do about this. Now, the Lord is so perfect in his ways. When a little girl is born today, she's equipped with all she needs to have a baby. And the things she needs are the ovaries, the tube, the womb, and the cervix. Now, of those organs, you have 2 ovaries, 2 tubes, 1 womb, and 1 cervix. Okay? The 2 ovaries have over 6 million eggs in them. Because the Almighty God has done it once and he doesn't want to bring the lady back again to put more eggs in it. Okay? So you have enough eggs to last you your lifetime. The course of period is at the appropriate time, depending on the environment, at the age of 10, between 10 and 12, a young girl starts having period. The reason she's having period is because one of the eggs in the ovaries grows to a certain stage, gets extruded into the tube, goes into the womb. Now, what the Lord has made the ovaries and the womb for the girl, is to create babies. If in a given month, there's no sperm to fertilize that egg, something happens. Because for the first 3 months of every pregnancy, it's dependent on the buildup of the womb. If fertilization, that is meeting of the egg and the sperm, doesn't occur, in disappointment, the womb bleeds. That's why you have your period. Okay? Now, there are 3 groups of women that I'll take in answering this question. The 10 to 15-year-olds, the 20 to 45-year-old, and the after 45. I don't know what age you are, but I'll cover it all. Between the ages of 10 and 15, the ovaries are practicing to do what is right. They don't get it right. So sometimes you have 1 or 2 ovaries being produced in a given month. So a little girl comes to you and says, Mom, I had my period 2 weeks ago. I've got 1 again. It's normal. Okay? For the 25 or 30-year-olds to the 45-year-old, it's not normal. What it is that there is imbalance in the hormones that causes the release of the egg. So when you have that, you need to see your doctor. It's nothing unusual that medications we give you that puts that right. Between the ages of 45 and above, there's a risk involved in that. 2 things. The body is walking down, the ovaries coming up to the change. You don't produce as good an egg as you used to, so you could have that. So it might be a sign of the perimenopause. In other ladies, it's either a sign of endometrial cancer or cervical cancer. So whatever reason, if you're between the ages of 45 and above, you need to see a doctor for this. I don't know if I've answered the question.
Thank you so very much. I think you did a great job. I appreciate that. And there's another question coming to you. Okay, I see a hand here. I'm going to give my request again. Keep the questions short. Keep your answers brief. Come on, my dear. Happy to help.
Very happy to have the persons here. My question is very one that I have not heard much about, the OSA, that's the obstructive sleep apnea. I discovered that sometimes when I sleep, I stuff something in my ears. Is that a good sign? And this is something that I need to know because lately I have one of the ears that pains me, or it's stuck from my nose, goes straight across. So you find the section. Oh, what I'm saying is that when I sleep on the right side, the pain goes in the right ear from one nostril to the other. and it's very painful. Sometimes it's even a nausea in my head like. So I would happy to get some information on sleeping apnea. How dangerous it is, or is it wise to have something poked into the eardrum way down to clean it out, or to pour anything in the ear?
Yes, pediatricians thank you so much for your question. Pediatricians often tell their patients or the parents of the patients that the only thing that should go in your ears are your elbows, all right? It is unlikely that the issue you're having with your ears is related to obstructive sleep apnea. And so I would recommend you follow up with your physician that you can have an ear exam done to determine what the cause of those symptoms are.
Thank you so very much.
Sorry, I can't be any more specific than that.
Appreciate it. All right. Dr. Cooper has a question related to menopause.
So the question is, does menopause have an expiration date? That is, a time when a woman no longer suffers from its severe symptoms. Well, as I said, menopause, post-menopause, may last for most women up to 7 years after the period stops. So your period has stopped for 1 year, and you can count 7 years after that. If the 7 years have passed and you're still having severe symptoms, you ought to consult your doctor so that they can examine you and perhaps do tests to see if something else is going on. There are other things that can give you similar symptoms. For instance, thyroid problems can give you similar symptoms. And there are other conditions. So if you're not in the you're not in the right age range, if you're way into your 60s, your late 60s, and you're still having problems, you need to see your doctor. Don't assume it is menopause. The second question says, is there any way that a woman can lead a normal life after menopause where she no longer suffers from physical, mental, emotional, and sexual impact that it has on the woman without having to take medication? So remember I said menopause is a natural process. We need to remember that we have changes all throughout life. When you were a child, under 10, your life was one way. When you became a teenager, life was different. When you passed your teens and you got into your 20s, your 30s, life was different. You don't expect a 30-year-old to feel the same as a 12-year-old. In the same way, after menopause, it's not that you have to accept that life has changed. So you may not feel the same way, both physically, you maybe not be able to do as much as you could. When you're 20, you can run down the road without thinking about it. When you're 65, you need to stop and think, can I run down the road? Can I run up the stairs? Okay, see, it's life changes. Mentally, emotionally, many times at the time when women are going through menopause, a lot of other things are happening. This is a time where if you have children, your children may be teenagers, they may be in their 20s, you may be stressed because of issues to do with that. There may be marital issues, you've been married for many years. There may be, changes between you and your husband. There may be, your parents may still be alive and you're having now to support your parents. So you have parents to support, you have teenagers stressing you out, you have your husband stressing you out. So sometimes it's not just, the way you feel is not just the physical because your estrogen level is low, it's the circumstances at that stage of life. So as I said, the key is to have a flexible mindset to accept that life changes and to find the support, in all these things. There are people you can talk to, but not just healthcare providers, other women, especially older women, who can help you with some of these things. In terms of the sexual impact, things change for both men and women as they get older. So a lot of people in Jamaica don't discuss sex with their partner. This is something you ought to discuss with your husband. If you feel different, you need to tell him. If he's different, he needs to tell you. And the two of you need to talk about this and find different ways. Perhaps there are different ways in which you can be intimate at this stage of life than how it was. It's not going to be the same as when you were in your 20s. So you need to talk about these things, and that will help. If you can't manage to talk about it, perhaps a counselor could help you with this, or your doctor.
Thank you so much, Dr. Cooper. There was one other question there that I'd refer to Dr. Campbell.
It reads, I recently started feeling very lethargic and sleepy sometimes, dizzy. What could be the cause of this? When a patient comes to see the average doctor, one of the first things the doctor will do is to take a history. And a thorough history is important. So your doctor should be talking with you to get all that's needed to sort out the puzzle. Now, symptoms such as feeling lethargic, weak, tired, sleepy are not necessarily very specific to a given disorder, not very specific for a given condition. Dizziness may be related to cardiovascular issues. Dizziness may be related to issues involving the ears. And so to arrive at a diagnosis, we would need more information to see what is causing this. So
Absolutely.
Tomorrow, we will be at
Fellowship
Church.
Fellowship School.
Okay, I was just testing you. Fellowship School tomorrow. And I will make it my priority to see you, get a history, examine you, and arrive at the best possible diagnosis. And so I'll see you tomorrow at Fellowship. Thank you.
Or Monday at Portland High. So give them 2 days
Monday
option.
at Portland High.
That's right. I hear another question over here. We're coming down to the end. Actually, we're at 6:02. So what I'm going to do is I'm going to take only 2 more questions. Okay? 2 of my favorite people in here will get those 2. Okay? So as to honor your time, I give the elder the floor.
Thank you. I have a prostate problem in which the urine was locked off, and I went to the hospital and so on and so forth. I did a blood test, I did a biopsy, and the report came back, no malignancy found. But I'm still having the challenge. Could you explain what is happening and what I need to do to fix the problem?
Dr. Campbell or Dr. Cooper, you want to take this one?
Yes. So I'm glad that everything turned out well. You had a good biopsy, negative biopsy. Now, some of the symptoms you're describing sounds like it was benign prostatic hyperplasia, benign prostatic enlargement. And so I'm not sure whether the doctor had tried you on any other medication that could be used to treat this disorder. One of the most common medication used nowadays is tamsulosin or Flomax, and most individuals tend to have a good response to that. Now, I'm not sure why a biopsy was done, whether you said that you had a PSA, if the PSA was normal, whether it was high, I'm not sure. But if the doctor thought that there was a possibility of prostate cancer and a biopsy was done, I'm glad it was negative. Whenever we do a biopsy of an organ or a biopsy of an abnormality, we hope that we get a good representation of what's going on. Is there such a thing as a biopsy that's deemed negative and it was a false negative? I hate to say yes. Most of the time when a prostate is biopsied, it's usually done from multiple sites. So there's that one possibility. But based on what you're telling me, the most likely symptom would be benign prostatic enlargement. And I'd recommend that you follow up with your doctor if the symptoms have persisted.
Thank you so very much. I appreciate that. I hope that answered your question. Thank you so much. Dr. Aladepo, I think you have a question from the audience that I'd like you to have. But before you answer, I have been updated that we do not end at 6. So I'm going to go ahead and give 10 more minutes, 10 to 15 more minutes, Grace, so I can take more questions, because this is for you and we'd love to get as many questions in. So again, keep it short. Go ahead, Doctor.
The question I have here is, I have a fibroid issue. I did a myomectomy, and the fibroid issues have returned. I have not had a period for over a year. Should I consider a hysterectomy as recommended by my doctor? I am 52 years old. Very good question. Now I'm going to explain 2 terms using this for those non-medical people. She said she had a myomectomy. A myomectomy is when you take the fibroid out of the womb without removing the womb. The next thing she says is the doctor is recommended hysterectomy. Hysterectomy is taking out the womb. I like illustrations because it makes things easier and you tend to retain it more. Let's start from fibroids. What are fibroids? The womb itself is a muscle. And that's why some women can have one baby in the womb, twins, triplet, because it's an elastic muscle. Okay? A fibroid is excessive muscle on the fibroids, either within the inside of the fibroid, on the muscle itself, or on top of the uterus. So that's fibroids. We as a black race, we have the highest number of women who have fibroids. It's very common. So I wouldn't lose a sleep over a lady saying she has a fibroid. If you go to the Portland market and close your eyes, select randomly 100 women, between 40 to 70% of them would have fibroids of different sizes, from a peanut to a mango size to a huge one. Now, saying that, what do fibroids do to women? I return to the Lord again. Is a perfect engineer. He's made every structure in our body and is giving us those structures or organs their space. Okay? Just like you and your neighbor have your borders. If you want to cause trouble, break down your neighbor's fence and see what happens. When the womb starts to grow with fibroids, it leaves where it is and presses on other structures. Fibroids cause 3 problems. If you don't have any of them, you don't need to worry. Number 1, excessive bleeding. Number 2, pressure symptoms. Pressure symptoms in the sense that the womb has outgrown its own size. It's gone on to the next neighbor and is pressing on other structures. The structures that are close to the womb, in front is the bladder. Behind that is the bowels. If your fibroid presses on your bladder, you tend to go to pass urine frequently. You go there, you pass a little, you're out. Is the pressure on the bladder, okay? If it presses on your bowels, you sat in the bathroom for 10, 15 minutes just to pass a little stool. So those are pressure symptoms. Excessive bleeding, pressure symptoms, and the most important ones, depending on where the fibroid is, it causes infertility or subfertility. So those are the 3 problems we doctors look out for when you tell us you have fibroids. Much more importantly, this lady says she's 52. We know the fibroids grow when your hormones are still functioning. When you get to the menopause, the ovary ceases and you don't produce any more hormones. They tend to shrink, but they don't go back to normal size. So my first advice would be to find out what the symptoms this lady has. She doesn't have fertility problems, not at 52. She doesn't have bleeding problems. She said so in this letter. So the most likely things, maybe she still has pressure symptoms. If all you have is pressure symptoms, then I would say see your doctor. But at 52, if you don't have any symptoms or any issues, I'll leave your womb alone.
You heard it here. Okay? Thank you so much, Dr. Ali Depo. If you handed in a yellow sheet of paper with a question and it has not been answered, please indicate that it is not so I can make sure it gets addressed before. Go ahead.
So the question is, could you talk about diabetes and poor circulation? So I kind of touched on this earlier. Essentially, whenever you have uncontrolled blood sugar, the excess sugar in your body deposits in the blood vessels. The blood vessels are what brings blood supply and oxygen to our organs, and they also bring it to our nerves. The blood vessels that bring it to the nerves are very, very small, and they tend to be the ones that get closed off first. So this is why a lot of times diabetics, when your blood sugar is uncontrolled for a long period of time, the first thing you'll start to notice is numbness and tingling in the lower extremities, so in your feet, and we'll call it poor circulation, but it's really just because those nerves, the arteries that's supposed to bring them oxygen for them to function, those arteries are clogged off and the nerves essentially die. You lose the feeling in the feet. You lose it in your hands. There's also small blood vessels behind the eyes, so you can start to lose your eyesight. So that's essentially why there's poor circulation. And then also, the excess sugar is also going to the major blood vessels, the bigger blood vessels that also, they deposit around those vessels that bring blood to the heart, which is why elevated blood sugar and diabetes can cause a stroke, it can cause a heart attack, but it also clogs off the blood vessels that bring blood supply to our brain, which is why it can cause a stroke.
Thank you so much. Does that answer your question? Fantastic. Thank you so very much. Briefly.
And also to add that, a lot of times we focus so much on that neuropathy that you're talking about, and you don't realize, just like the doctor said, you've got to get that blood sugar under control, because sometimes we're like, let me get rid of the neuropathy, let me get rid of the numbness in my feet, but yet we're not controlling what caused the problem in the first place. So that's really something that you really want to work with your healthcare provider for.
Thank you so very much. Are there any other question here?
Hi, this question is for the three women's health providers. The first question is there a possibility that a woman can go through a menopause before 45? And secondly, is there a better time of the month for you to do your breast exam at home? Sometimes before your period, your breast may be a little bit tender. So is there a better time of the month for you to do your breast exam?
Dr. Ali Depo.
Very good question. Some ladies in the range of between 4 to 5% of women come down with menopause before you're 50. And this is called primary ovarian failure. There's so many reasons for this, and you need to see your doctor. Essentially, what it is the ovary just fails at an early age, and it stops to produce the hormones, and no doubt the body just reacts to that as if you're more than 45. Now, what was the second question again? Sorry.
When is a good time to do breast
yes, sure.
exam?
Yes. I think I did mention that, the best time not to do it is during your period, because your breasts are tender. Any time before or after that would be ideal.
Anytime before or after would be?
Ideal.
Would be ideal. So before or after, but not during, would be best.
All right, okay.
Okay,
I think I've been corrected. Yes, they've just told me what she said. I would say wait for your periods to be over and then do it then. Yeah.
Okay.
You want to do it cyclic, the same time monthly.
All right. And so, was your question answered? All your questions? Very well. Thank you so much. Okay, right here.
So, we talked earlier about hypertension. As we know, a lot of black men tend not to take their blood pressure medicine because they're concerned about their libido. Please address that and emphasize how important it is to take the blood pressure medicine, because if there's a stroke, there will be no libido afterwards. Also, one thing that you guys have not addressed yet is mental health and mental wellness. A lot of us sometimes are even depressed and don't even know that we are depressed. So could we bring a little light on mental health, mental well-being, and also personal self-care, please?
Okay, Dr. Campbell?
Yes, so you're absolutely correct. Many men who have high blood pressure, which is a cause of erectile dysfunction, they do not take their blood pressure medication because they're looking at that to be a cause of their problem with erection. Unfortunately, it is very common, and it's true that there may be a couple agents that may contribute to that, but if somebody does have a problem with erectile dysfunction, the cause should be sought, and it should be borne in mind that high blood pressure, diabetes, may be a cause. I leave it there.
Just to add to that, one of the major medication that contributes to erectile dysfunction in men is not a typical treatment of high blood pressure. So it's not even something that we typically give to treat high blood pressure, but uncontrolled high blood pressure and high blood sugar can definitely cause a low libido and can contribute to erectile dysfunction.
Okay, so we're saying though there are some meds that can cause decreased libido or sexual desire, it is not the only cause, and we shouldn't use that as an excuse for not taking our blood pressure. There was another question before added to this.
In general, stress in this day and age with social media and our young people, and especially young men or men in general, who likes to hide their feelings. Yes, it's very common for us to have depression, anxiety, panic attack, and our social media isn't helping the situation. It is highly recommended if you're feeling overwhelmed, stressed, where you're not happy for the same things that normally make you happy. You don't have the same drive. The things that usually intrigue you don't intrigue you anymore. And you just feel like you should just crumble and cry or give up each day. You should probably seek help from your general practitioner. Speak to them so they can get you to... At times, people hear mental health and think you're crazy. Mental health and think you need medication. And it's not so. It's a false. Sometimes you just need to speak to someone who can help you sort through and box your emotions into its proper aspects and help you deal with them individually. So we need to take away that negative innuendo from mental health illness. You know, you hear mental health, you're mad. It's not so. Mental health encaps a lot of things, and we should be willing to discuss this with your GP or your whomever it is. Most of your practitioners are aware of it, and they have screening tools that they can use to help you and assist you to get the help you need.
Okay, there's one question here. Still have the question here? Still? Yes? All right. And then over there, and then to the back, and that will round us out for the evening. I'll let you
Good evening. I'm to ask the panel board, eat and drinking. Is a diet. Because sometimes people have a bad stomach. You must know if that's a part of the diet, the living diet, for eat and drink. Meanwhile, sometimes people have non-proper diet. So you must know what is it.
Am I understanding you? You said, what is a proper diet? What you should eat and drink? Okay. All right. Dr. Cooper, it's a proper diet. What do you want to eat and drink? I'll give it to Miss Allison.
Okay. So I'm trying to make sure I'm understanding. When you come to, when somebody's asking about proper diet or what you're going to eat, everybody's individualized. So, and you're saying something about drinking and eating at the same time or something like that. Well, you have to understand in your stomach, there's some digestive enzyme to help you to digest your food. So if you're eating and drinking at the same time, you're going to start diluting that. So it's always best for you to eat and then drink later. So try not to eat and drink at the same time. Is that what you're asking? Okay. And again, depends on what are you dealing with. You know, what are you dealing with? Are you dealing with acid reflux? It really depends. That's something that you might want to meet with somebody on an individual base so that we can see specifically what your needs are, because it does make a difference.
Thank you, Miss Allison. Okay, question over here in the red.
I have two questions. One is for my friend. But driving coming from Runaway Bay just day before yesterday, I'm in my early 50s. The baby started to cry, and then it seems like I was getting off. I started to hear voices in my head to pull the car door to get it open, to come out. The person was telling me that, Maxine, my name is Maxine, open the door, just come out of the car, just step out of the car. The baby was really crying. I noticed that whenever a baby is crying, it always triggers this thing in my head. Those voices are loud and clear. When my daughter, she was driving, she had to stop the car, put on the four-way, and take the baby from me. I have to get out of the car, and I was trembling and shaking. I'm wondering if it is the cause of premenopause, or what is the cause? Because those voices were happening just after I have a baby. She's now 9. And then it started to come back once I started to hear babies crying. And they continue to cry, and it get really sick and start to shake. My friend is asking what causes person's period to skip if it is not period. The person is 45, and she's asking that. So 2 questions.
Okay, 2 questions. You're going to take you want the first. Go ahead.
Is this, and there was an actual baby in the car. Okay. So based on this, I would allude to the fact that you probably had some postpartum depression that you never dealt with.
I was seeing what is the word, psychiatrist, something like that. And when we spoke, when we finished sessions, I even get worse. Because once I couldn't even be near boiling water. When I'm cooking, that voice keep coming louder and louder. So I have to stop and go. My little daughter used to know that once mommy gets sick, she went into the room and locked away herself. But I thought it had stopped. But just day before yesterday, coming from Runaway Bay, it was really terrible. The voice was saying loud and clear, Fufu Maxine, pull the door and come out. So when I reached, my daughter drop off, stop, I have to drive to Portland, continue the way. And it was an ordeal to come to Portland.
Okay, Miss
Well,
Maxine,
thank you so much for sharing that with us.
You're not a Fufu Maxine. This is a true mental emergency. Your depression sounds like it's moving over to some psychosis with it, some schizophrenic with it. So, and it's probably not a diagnosis now, forgive me. However, I think you need more than counseling now. You need to see, besides a psychologist, you probably need to see a psychiatrist who can, along with the therapy, give some medication to help you, because this isn't, it's, and how often are you having this? You have to go and seek help like yesterday.
All right, I am good once a baby is not crying excessively.
Very well.
Once I'm around a baby and it is normal, but the baby starts to cry for more than 3 minutes, I get weak, I get sick. But because I'm accustomed for a person to say that I'm mad and so I don't take it real serious. But now what happened Thursday, it was loud and clear, and my daughter have to stop in the middle of the road and take the baby, and I was shaking. I have to get out of the car. I am wondering if it is premenopause or it is something more than that.
Okay, I think I heard from the health professionals that it is not likely related to menopause at all, but it might have been something that is triggering you mentally from your past. And so it is best for you to follow up with maybe both a psychologist, a therapist, as well as now, especially if that frequency is there, for you to see a psychiatrist. The beautiful thing is you recognized it, and you recognized that it wasn't something safe to do. But let's make sure that we get a handle on it so that we don't get to the place where we can't distinguish whether it's real or not and what you should do, okay? And feel free to speak with one of the practitioners after, because you might need a little bit more personalized, private conversation. Thank you for sharing that. I appreciate that transparency there. The other one was, what if you skipped a period? We got to that one. Okay. Any more questions? One last one to the back. Thank you, sir.
Let me say that I'm glad for the opportunity of being here. It's not every day that we find so many doctors in the house, and I'm glad for that. I know that your clinical practice starts tomorrow, but you guys have been coming here over a period. What is the shape of our community? What I'm trying to say is that we are not always able to attend the doctor as we ought to attend the doctor. Maybe because of financial constraints, and some of us have some little fears that we don't really like to approach the doctor because of what he might tell us. So I'm asking, in your previous visit, what is the shape of our community? Can we feel a little safer from the way that you have examined our community?
Dr. Campbell, you want to take it? You've been here before.
This is one of the most friendly, caring community that I have encountered. You guys are nice. You guys need to give yourselves a hand. I love coming here. We appreciate the kind hospitality. And I say that to say this. Do not underestimate the importance of your community. Meeting together, talking with each other, sharing with each other. The fact that you come out to the clinics and the fact that you're here tonight, this evening, speaks to the kind of individuals you are, that you want to make a difference. You want to learn about yourselves. You want to learn about your community. So that's great. I I think that there is always need for improvement, especially as it relates to healthcare. I don't think there's going to be a point where we can say, okay, we have arrived, we have healthcare available for everyone. There are going to always be needs, there are going to always be barriers. So there are issues related to you individually as patients. There are issues related to what the community leaders, the government can provide as far as what is available. You as individuals need to realize that you need to go to your doctors, take care of yourselves despite the barriers. So the state of affairs is this, from my perspective. It's not where to be honest, it's not where we need to be. It's not just this community, the community where I'm from, where I live. It's not where it needs to be, and a lot of changes are needed. But if you guys get together as a community, talk, approach your leaders, identify what the issues are, I think we will continue to see improvement.
Thank you so much, providers. You have been awesome. And audience, thank you for your questions. Thank you for your attention. Thank you for your presence. I know we didn't get to everyone. I know we didn't get to everything. But again, I'll remind you, we will be at Fellowship School tomorrow, and from 9 until hopefully just 5. And we will be at Portland High again on Monday morning, bright and early at 9. Okay? Hope to see you there. If you need us, sir, to your question, what's the state of affairs? I think it is stable. I want to see it improve. I can tell you, we see a lot of patients here with blood pressures that are really, really high, that they've been living with. There's something that's not. We just had a hurricane, right? We've had issues. And so we have to put things in context. But overall, I think that's one area we could do a better job with, of really just simply going to your provider or going to a place where you can get your blood pressure and your blood sugar tested. Just for starters, I only give you 2 assignments, right? Get your blood pressure checked and get your blood sugar checked. All right? And we'll take it from there. But thank you for that question. Thank you for being an awesome audience. May God bless you. Thank you.
Okay. Good evening, everyone. All right. It is my esteemed privilege to say thanks on behalf of the officers and members of the Port Antonio Seventh-day Adventist Church. Thank you for being here. The heart-to-heart team. The scripture tells us that my people are destroyed for lack of knowledge, and you have helped us today to gain some more knowledge. And so thank you. You have provided invaluable information. And of course, we have learned a lot from it, and we will take heed, I'm sure, to a lot of these things. And so it will help us to be better. We look forward to further interaction at the clinics. And we just want to say, please take time to enjoy some of the attractions. And before you go, and so God bless you as you continue to minister. Thanks again. Can we give them a round of applause?
taking it with me.